So here's what the World Health Organization said about the recent Ebola epidemic in Liberia. At the peak of transmission in August and September 2014, Liberia reported between 300 and 400 new cases every week. During those 2 months, the capital city, Monrovia, was the setting for some of the most tragic scenes from West Africa's outbreak. Gates locked at overflowing treatment centers, patients dying on the hospital grounds, bodies that were sometimes left for days, flights were canceled, schools were closed, fuel and food ran low. But public health experts said that it was the 1,300 Liberians that your organization, Last Mile Health, trained, many of whom were rural villagers without any previous healthcare experience, that kept the virus at bay in many parts of the country. How did you do that?
Well, thanks, Cliff, and it's good to be here. Well, first I would just reframe it and say that there were many groups, many of you here in the private sector, who helped respond to our epidemic. And there are NGO partners here as well. I see the IRC here, our friends Gary Gottlieb from Partners in Health. Those were all critical. Treatment units were important. Lab systems were important. One of the most important interventions was actually training people in the communities most affected to help educate communities about how the virus spreads, to help ensure that people were burying their loved ones safely if they got sick, going door to door to find who was sick and get them into healthcare. Those are called community health workers, but many of them were the loved ones and relatives of the very people who were at most at risk of feeling sick. So it was those, our organization was one of many that contributed. It's said that some 10,000 rural Liberians and urban Liberians, some in poor slums, went door to door to help stop the transmission of this disease. So definitely a lot of the international community mattered, and that partnership with those local communities mattered. And Liberia is now taking that lesson and trying to do something about it by investing in those workers.
You know, we talk a lot about technology in healthcare, and in fact, we just finished a conference, the Fortune Brainstorm Health Conference, which was really about technology. But a lot of the stuff that you talk about is pretty simple. I mean, you know, it's as you said, door-to-door community work. You actually can talk a little bit about the kinds of, you know, work that people can be trained to do effortlessly.
It is, you know, right now there are 1 billion people on the planet who have no access to healthcare because they live too far from the nearest clinic. They live too far from city centers. The hotspots of inequality correlate very closely with the hotspots of disease. That was true in Ebola. A two-year-old boy died in a rainforest community hours away from the nearest clinic. It's true of recent elections. Diabetes and obesity rates correlated more with the outcome of the US election than even typical political indicators did in rural America. And so in a space of moral uncertainty, one of the places where there are islands of moral clarity is to look where suffering is the greatest. And we have a good way of measuring that in medicine, mortality and morbidity. So 1 billion people have no access to health care. While there's been great progress in global health, child mortality has been cut by half in the last 25 years, we have left large portions of those people behind. And we have seen mortality rates not improve for those people. How do you solve that? When a 2-year-old gets sick in a village, mom has to take him to a canoe bed, to a riverbed, get in a canoe, paddle to the other side, and then walk for up to 2 days just to get a diagnosis. How do you solve that? Well, what we try to do is to take women like Musu, who I was just working with a few weeks ago and will be back on Liberia in a few days working with, and train her. She was 18 years old in a rural village, got a high school degree, which is a very hard thing to do in rural Liberia, went 30 years without a job until she was 48 years old. Was seen as a community leader. Last Mile Health with the Ministry of Health went in and asked the community members, we want to stop death rate of children in your communities. Who here could be a great health worker? Musa raised her hand. We trained her, equipped her. You know, lots was made this morning about what the outcomes of technology. Here's a place where technology has been critical. lab tests like this, which some of your companies have made, $1 malaria test, medicines like this that used to be you could only get at hospitals, and now you can put in a medicine chest or a backpack for a woman like Musu to give. Thermometers, which have been around for a long time, so technologies have been around for a long time. You give someone like Musu these types of equipment. You train her for a few weeks or a couple of months, and she's managed to stop child deaths in her own community. But she's also gained a job from that. She gets paid $70 a month to do this health care. And so what we've started to ask ourselves is, what is the role of these community health workers if we pay them, if we professionalize them, if we formalize their work? There are so many thousands of informal health providers. If we can give them jobs in rural areas, could we help close this inequality gap in healthcare and try to create jobs in rural areas?
Now, apart from the crisis stage, you know, when you're in the middle of an epidemic like Ebola, you've said that health is misunderstood in Africa, that there are actually 3 overlapping but distinct public health epidemics, chronic health epidemics, that affecting the urban rich, the urban poor, and the rural poor. Can you talk a little bit about that? And why do we miss that?
Yeah. Well, I think we are very focused on infectious disease epidemics, HIV, AIDS, Zika, Ebola. Those tend to, I think one thing we worry about is that they're transmissible, right? I mean, they could come and strike us. And we saw that with Ebola. That reached the soils not just of my country and the ones next to it, but United States and other parts of the world. But the chronic disease epidemics, the non-communicable diseases, high blood pressure, diabetes, obesity, are also epidemics that transmit. I mean, they transmit where poverty is. They transmit where inequality is. Richard talked this morning about the fault lines of inequality. If you look at the fault lines of these diseases, where is it more likely to happen? They correlate very closely with poverty and inequality. So I think the good news is, while those diseases and do exist, while we have not yet solved them, there are ways to apply techniques we've used for infectious disease epidemics, controlling it with, say, Ebola community health workers, training those same health workers to, say, focus on high blood pressure and mental health.
Now, we have such a short session that I do want to open it up to at least 1 or 2 questions out there. But before I do, Alan mentioned that yesterday you won the TED Prize, this $1 million prize. So I assume you're buying lunch for everyone today. Right? And in that, you said that in April you would reveal your bold wish for healthcare. So why wait till April? Why not just tell us right now? Let's make a little news.
Well, we're really honored about the prize. You know, the prize, we've had the chance to work with the TED community, which I know many of you might be part of or involved with, and we will be working on developing this prize. It will build on the work in Liberia. I mean, the government of Liberia, with the help of a number of partners here, is trying to scale to reach those 1.2 million people in the country who have no physical access to healthcare in rural areas by employing 4,000 community health workers over the next 4 years in those very villages. So giving young, rural, unemployed people jobs to provide healthcare. If every country could do that, and some countries like Rwanda have already done that, Ethiopia has done that, if other countries, including America, could do more of that, there are 48,000 community health workers in America, if more investment was put there, we could really dramatically scale our collective efforts. The TED Prize will build on that work. But if you have ideas for how we could use it and want to collaborate, we would be
well,
very
let me ask you. I mean, the business community is gathered here, and this is an effort to forge this new social compact. What can business do to make your wish easier?
You know, I think it starts with getting over our bias against rural communities. One of the faults with capitalism as it's currently construed is that we do not see opportunity where there is not a high density of consumers. In rural areas, by the numbers, by definition, there are low densities of consumers. So what I would ask is that you ask your general managers in poor countries to first think about how to overcome that challenge. Hire people from those communities to be health workers, if that's the case, but if you're in farm products, team up with a group like 1 Acre Fund. Andrew Yoon is here to do product delivery for helping local farmers get better. So hiring people from those communities, number one. Ask your general managers to do that. For your R&D units, ask them to design products that work in off-grid, off-road, off-network places. Things that are handheld, that can be powered by solar, that don't require electricity, can enable work to be distributed further. I mean, look, my profession, being physician, is the greatest culprit of a guild mentality. If we are willing to shift tasks that are usually confined to doctors and nurses into community health workers, imagine what more we could do if the products were available like the ones I just showed for those workers. The third thing to do is around supply chains. Think of these folks as your partners to distribute your products. I mean, the frontier markets there's no competition in these places. You can actually succeed if you go out there. So if you're thinking about long-term sustainability as a CEO and your business, accelerate your business, scale it, but let it reach those people. So that's what I would say for those that create products. In terms of those who create infrastructure, I cannot overemphasize how critical communication infrastructure is in these places. If you can take cell phone communication and you can take energy infrastructure and bring it to rural areas, they might require new business models. That would lift so many of the people in these places. The mooses of the world would be able to use their smartphones and not be off the grid. She has one. She uses it for clinical care, but she's not connected to a network. If she was connected to a network, think about how much more she could do and how much more her community would be connected. So connection's the last piece I would argue for.
Well, in our effort to make this as fast and dynamic as possible, we've run out of time for questions, I'm sorry to say, but thank you so much, Raj Panjabi.
Thank you.
Thank you.